So I'm here at DFW Airport getting ready to take a flight to Orlando, Florida for I think it's the 15th anniversary conference for eClinicalWorks. eClinicalWorks is the electronic medical record that our family practice has been using for the last 15 years. And so I've been to about 12 of these conferences, and the goal of attending these conferences is to try and figure out how to help the doctors and nurses get the most out of the product so that we can give the best level of care to our patients. It's very difficult when we're in the room. We've got a lot of different tasks we need to do. And I remember back in the day when we went from paper to an electronic medical record, and it was pretty amazing. The paper charts were so cumbersome, and we'd have these little carts coming around with the paper charts, and you'd have a telephone message, and they'd have to write down the message, and they'd put the little paper chart on your desk. And I remember there was one picture of the before and after of the electronic medical records, and one of our doctors' desk was just covered up with paper charts. So that was the before, and then after, oh my gosh, just one little computer and no paper charts. And that was such a big revolutionary change. And it was really wonderful to go from paper to electronic records, but the problem is that a lot of the jobs, a lot of the tasks that take place taking care of patients were sort of dropped down on the doctor. And so, for the last 15 years, I've gone to these EMR, this eClinicalWorks conference, trying to figure out how do we make it easier for the doctor to take care of the patient and do all the different jobs, from writing prescriptions to sending referrals to documenting everything that happens during the visit to making the next visit, putting in the charges. It's just a ton that the doc has to do. And all the while trying to pay attention to the patient and give them the best care. It's a big deal. And so eClinicalWorks, to their credit, has been trying for a long time to make the record safe and to also make it user-friendly for the doctor. And they've also done a really good job at helping the patient be able to access their medical records and access their doctor. We have a good patient portal that has been around for a long time, and it's wonderful. But the big problem is all of these tasks are distracting to the physician. And so what I found in my searching for a solution came upon, and this was actually back about 10 years ago. We were looking for a way to make a better practice situation. We thought that how can we become a primary care center of excellence? So we have a residency program, and we're looking to integrate residents into working with the physicians. And so we said, well, what can we do to try to help the residents work with the physicians a little tighter? And so we said, well, where are some of these primary care center of excellences? Where are they taking place? And it turns out Bellin Health in Green Bay, they had been doing this for a long time, and they were putting on a training camp. So in 2000, it was actually 2017 that I attended the Green Bay training camp, and it was eye-opening. So their solution, eClinicalWorks was looking for a technology solution. Bellin Health's solution was a team-based approach. And so what they realized was that all of these tasks that the physician is needing to do around patient care could be done by a team. So they encouraged the use of really high-level medical assistants to do the documentation for the visit, and to have co-located the operators, for instance, to have the operators right in the clinical care space. And so that was huge. And so we came back to Texoma Care and have really been able to implement this this form of practice. And a lot of patients, some of my patients might be watching this. A lot of my patients have seen how this works. Before this advanced team-based care, I would be not able to pay very close attention to them. I'd be on the keyboard, click, click, click. I'd be trying to send prescriptions. I'd be trying to do all these things. And honestly, I'd get distracted. And a lot of times I'd forget to do something. And it was not so great. So now when a patient comes to see me, I'm just looking directly at the patient. I'm able to brainstorm about what needs to be done. And my fantastic medical assistant, Nikki, is sitting in there, and she's helping do all the documentation. She's writing the prescriptions, she's sending the referrals, she's doing the billing, she's making sure all this with my direction. We've worked together closely, so she knows exactly what I need. And so I'm going to this conference, the eClinical Works conference, this weekend, and the goal is really to help doctors that are using eClinical Works implement this team-based care. This is partly a strategy to reduce burnout. So at an increasing rate, especially after the pandemic, physicians are experiencing burnout. And a lot of it has to do with the fact that they're spending so much time after the visit having to do the documentation and having to do these tasks that someone else could be doing. Anywhere from an hour to an hour and a half of time is being spent by physicians doing this documentation and doing these other tasks. That's soul crushing. That's really super hard, and it's increasing burnout. And burnout is a patient safety issue. If physicians are burnt out, then they're not delivering safe medicine to their patients. So the goal, and I'll post some more videos, the goal is to get to this conference, and I'm going to be presenting with the Chief Information Medical Officer, Dr. Keith DeBoyer. I'll be presenting with him, and so yeah, you guys can come along and see how that goes. It's going to be really cool.